Hi, welcome to another educational podcast video. I'm Demi, I'm one of the speech and language therapists at Princess Alexandra Hospital, and today we want to talk about diet and fluid consistencies and IDDSI. So when caring for patients, you might notice that some people have advised to have diet or fluid consistencies. These might be different to what you might be used to seeing. And these are described using different levels and different descriptors. They're usually recommended by a speech and language therapist for people who may have a swallowing difficulty, which is also known as dysphagia. So if a speech and language therapist has recommended a specific diet or fluid level, this will usually be written on the patient's bedside board. We use green and purple signs. It will also be updated on kitchen boards, and it will also be documented in the patient's electronic record. These different levels correspond to a framework called IDDSI. But what is IDDSI? What is the difference between each level? And why do we describe them in this way? So IDDSI stands for the International Dysphagia Diet Standardisation Initiative. It provides global terminology to describe food textures and drink thickness for people with dysphagia. The idea is that no matter where you are in the world, no matter the care setting, and no matter your age, everyone is using the same language to describe food and drink consistencies. This helps make sure that people are receiving the correct consistency for their needs and hopefully reducing confusion and helping to keep people safe. So the IDDSI framework uses a scale from level 0 to level 7 to describe different food textures and drink thicknesses. So for drinks, the levels range from level 0, which is thin fluids, through to level 4, which is extremely thick fluids. As the level number increases, the drink becomes more thick and it flows more slowly. And then for foods, the levels range from level 3, which is liquidized, up to level 7, which is regular. And as the level number increases, less modification is needed and the food becomes more textured. So we're going to go through each level in a little bit more detail now, and we're going to start with some fluids. So starting from the bottom of the triangle with level 0 thin fluids. So level 0 fluids are just normal drinks with no thickener added. So examples include your standard water, tea, coffee, squash or milk. So moving up the ladder a little bit to level 1 slightly thick fluids. So level 1 fluids are slightly thicker than your regular drinks, but still flow quite easily through a straw. They require a little bit more control to drink than thin fluids. And I think it's important to note that in hospital here, with the brand of thickener that we use, we want to use 1 level scoop of thickener per 200 mils. So with your standard cup, we have a measuring sort of scale on the side, and 200 is at the top here. For your reference, one of these jugs also goes up to about 750 mils, but I would advise against thickening a whole jug at one time and measure out your 200 mils in a cup instead. So again, moving up, level 2 mildly thick fluids. So these level 2 fluids can be sipped from a cup or through a straw, but they flow more slowly than level 0 and level 1. They require a bit more effort to drink, and they provide additional control during swallowing because they move more slowly. So these drinks require 2 scoops of thickener with this brand. Moving up again, level 3 moderately thick fluids. So level 3 fluids are thick enough to be drunk from a cup, but aren't really suitable to be drunk through a straw. It flows quite slowly and can usually be taken from a spoon as well. These drinks require 3 scoops of thickener. It's important to note here that level 3 moderately thick fluids are the same consistency as a level 3 food, also described as a liquidized diet. So this is where our IDDSI triangles fuse a little bit. So moving on to liquidized diet while we're here, a level 3 liquidized diet is smooth with no lumps, can be eaten with a spoon and don't require chewing. For example, think about a smooth blended soup. Just a note on beaker lids. Unless instructed specifically by a speech and language therapist, please avoid using beaker lids as they're unnatural to drink from, and actually sometimes they can increase risk of aspiration when food or fluid goes down into the lungs. So Level 3 thickened fluids, they move more slowly. They can usually be taken from a spoon as well, and these drinks require 3 scoops of thickener. This is sort of where the IDDSI triangles fuse a little bit, because a level 3 moderately thick fluid is the same consistency as a level 3 liquidized diet. Thinking about a smooth soup, smooth blended soup. So a level 3 liquidized diet are smooth, as I said, and have no lumps at all. They can be eaten with a spoon as well and don't require chewing. Moving on to a level 4, up the levels again, to extremely thick fluids and also a puree diet. So level 4 fluids are extremely thick, as the name suggests, and they are usually eaten with a spoon rather than drunk from a cup. Using the thickener brand that we use here at the hospital, these drinks require 7 scoops of thickener, so it's quite a jump. So a level 4 extremely thick fluid is the same consistency as a level 4 food, which is also known as a puree. So at this level, food is completely smooth and has no lumps or bits. It can hold its shape on a spoon and doesn't require any chewing. For example, a smooth yogurt or a custard. If you are serving a patient a pre-modified puree meal, please check the description on the packaging to make sure that it is the right level. Also, please note that the allergen-aware meals do come in a similar sort of circular packaging to pre-modified puree meals, so it increases the need to just check what you're serving before you do. Moving up the diet ladder again to a level 5 minced and moist. So a level 5 minced and moist food are soft, moist, and finely minced. Small lumps are allowed, but they should be easy to mash with a fork and require only minimal chewing. So for adults, these small pieces should be no bigger than 4 millimeters, and pieces usually are small enough to fit through the prongs of a fork. For example, a rice pudding or finely minced meat in a sauce. Again, another note on packaging, if you're serving a patient a modified minced and moist meal, please just confirm it's the right level before serving. Moving up the ladder once more to level 6 soft and bite-sized. So a level 6 soft and bite-sized food is tender, moist, and bite-sized as the name suggests. Pieces can be broken apart quite easily with the side of a fork or a spoon. And for adults, these bite-sized pieces should be no larger than 1.5 centimetres. So examples of foods for this texture might be tender chicken cut into small cubes or small pieces of cake in custard. Again, as with all modified meals, please check the packaging before you serve to make sure that you're providing the correct level to the patient. Another note, sometimes a patient might be recommended a soft or a low fibre diet by their medical team. This does not necessarily mean a soft and bite-sized diet, and it might be advised for a surgical reason rather than due to a swallowing or dysphagia problem. So in these cases, if you're not sure, I would just check with the medical team to see what they mean. Up the ladder once more to level 7. So level 7 is a little bit different because it has 2 subcategories. You have level 7 easy to chew and level 7 regular. Going through level 7 easy to chew to begin with. These are everyday foods and they are unmodified, but they still are soft and tender. So these foods should be cut easily with the side of a fork or a spoon, but aren't necessarily restricted to bite-sized pieces like a level 6 soft and bite-sized. Hard, tough, chewy, fibrous or crunchy foods should be avoided. So examples of easy to chew foods include soft omelettes, cakes, bananas, and jacket potatoes, but without the skin. Bread is not usually allowed on this level unless it's specifically specified by a speech and language therapist. So something like this cake, if you bite into it, would be a level 7 easy to chew. A level 7 regular diet is an unrestricted diet, basically, just normal everyday foods. Harder textures don't require texture modification. These can be dry, crunchy, fibrous. They can have skins, like some certain fruit or veg, and they usually require more chewing. For example, biscuits, crackers, Peas are an interesting one. Peas actually have a skin on them and therefore they can be harder to chew, so are a regular consistency. Tough meats and hard vegetables are all a level 7 regular. So I just wanted to run through quickly some examples of recommendations you might see on a patient's bed sign. So we've got our green sign here. So this says patient is on an easy to chew level 7 diet and slightly thick fluids, which is level 1. We've also got some strategies here. So alert and upright, check mouth is clear post swallow, and please complete regular mouth care. I really want to draw attention to strategies and alerts which are written on these signs and are also written in the patient's electronic record. These are supportive strategies and they're tailored specifically to each patient's dysphagia profile, and they are just as important in improving safety and efficiency of the swallow than the actual modifications themselves. So another example, you might see this up. Someone might be on a level 6 soft and bite-sized diet and might also be recommended a level 2 fluids. We've got slightly different alerts here. So alert and upright, as always, but then open cup for fluids and small single sips. So just some extra advice. And finally, I've got a purple sign to show you. This indicates that the patient is eating and drinking with acknowledged risk. So in some cases, food and fluid modification can't completely rule out risk. And in these cases, we'll recommend the likely safest or most comfortable consistencies. But if you're feeding a patient, you might still see some distressing signs like coughing or throat clearing or a wet sounding voice. So just to be aware. But for this patient, they've been recommended a level 4 puree diet. They've been recommended to have small single mouthfuls, a thin level 0 thin fluids. Again, they've been recommended small single sips and from an open cup. Alert and upright, slow pace, alternating food and fluids. So this is where you have one mouthful of food and you might need some fluids to help flush the rest of the residue down. So have a sip of fluid afterwards. And again, regular mouth care. Some people may therefore be advised to avoid mixed consistencies completely. So transitional foods. Some foods don't fit neatly into just one category, and these can change consistencies. These are called transitional foods. For example, ice cream as a solid is more of a puree, it's smooth, but when eaten it can melt into a thin fluid. The same goes for jelly. It can melt slightly once it's in the mouth, and ice cream and jelly are therefore not recommended for people on thickened fluids. These are transitional foods, so they are not suitable if you are on thickened fluids. Another note, mixed consistencies. So some meals might have mixed consistencies. For example, a dry and crunchy cereal might be a level 7 regular, but if you serve it with milk in the same bowl, which is a level 0 thin, you're sort of having to manage 2 different consistencies at once. So mixed consistencies might be harder for people with swallowing difficulties to eat. They require more oral control as you have to manage the 2 different consistencies at once. Some people might therefore be advised to avoid mixed consistencies completely. So for more detailed information about IDDSI as a whole, they have some really great resources on their website, as well as patient resources in a variety of languages too. So as a final note, what if you need to contact speech and language therapy? When do you contact speech and language therapy? So some patients are admitted to hospital already established on a modified diet or thickened fluids from previous recommendations. In these cases, a speech and language therapy review isn't needed unless the patient is not managing or tolerating these recommendations. If they are tolerating these diet and fluids safely, then there's no need for us to come and re-review. Please check existing documentation, for example, care home packs that might have been uploaded to the system to find out the specific diet or fluid recommendations. A referral to speech and language therapy would be appropriate, again, if there are concerns that the patient is no longer tolerating these consistencies. For example, if they are coughing, choking, struggling to eat or drink, or if there's a significant change to their medical condition. But as always, if you're unsure, please just speak to the speech and language therapy team and we can give you a bit more advice. Thank you for watching this podcast, and please watch out for the next one.